Welcome back to Trainer Tips. A common cue is feel like you're zipping up, feel like you're pulling your navel to spine, feel as if you engage that lower abdominal region. And oftentimes this is a cue that for me was something that I couldn't grasp onto. I didn't understand. I would pull in, and what I would do is actually isolate more my obliques, and I would kind of dive in and pull my belly button in, but I never really felt like my lower abdominals were working until I started having other people give me different kinds of cues, and also until I learned the importance of it and what exactly that zipping up meant. What did that mean? So you have this muscle called the transverse abdominis. The transverse abdominis isn't just here. It actually starts higher and has different kind of muscle to fascia. Fascia is how I describe is like chicken, that thin film. It connects our body really head to toe. It changes fascially as you move down. In the lower abdominals, we tend to see that connection, see the connection. We tend to be able to palpate it a little bit better for us who are doing the classes, and for the person who's cueing it can also cue it a little bit better there. So the first thing I'll say is that I had an instructor recently who said, sit super tall in a chair, maybe put your hands at your belly, and then feel like you pull yourself off the chair. So Cassie is my wonderful help today. And so I'm gonna ask her to put her hands at our belly. And if I ask you to feel as if you lift off the glide board, what does that feel like in your body? Do you feel your shoulders come up, or can you keep them down? And what happens if you kind of lift up? Can you feel the lower abdominals kind of come in?
You can feel them come in, but you do have to control your shoulders from coming out.
Exactly. So that's a cue that when people are sitting and they're doing any arm work, or even if we're just sitting there doing stretches, I'll say, keep your shoulder blades down, but have the sensation like you're lifting off that glide board. And that immediately people kind of pull in and up. For you who are in London who may see this, someone also told me they recently taught a class, and in London they said, imagine like you're seeing the Queen. Because I guess you pull in and up, and that's what you do when you see the Queen. But it's a sensation through here like you're drawing your navel slightly back. Now what I want you as a trainer to see is, are they doing this? Are they concaving in? Watch for their ribs here, because they could have overactivation of the obliques. And that's not necessarily what we may be looking for that person. Oftentimes, if they have high definition, or what we call their sternal angles really tight through there, they're not gonna get the best breath. But often, then maybe you're not working as much down here, that there's a compensation pattern happening. So another way to help people kind of feel this is I'm gonna have Cassie lie down just so I can kind of poke and prod and you can see at home. So remember, we're working through here. So another cue that you can do is have people's hands through on their lower abdominals. If I ask you to cough, you might see the abdominals come up and down. If I ask you to try to keep the abdominals in, where your hands are, try to pull your belly away from your hands and maybe clear your throat. And then, or maybe if you take an inhale and go shh, that's another way that sometimes can help use the breath, and changes in the breath changes the abdominal force, because you're changing intra-abdominal pressure to help facilitate the transverse abdominis. Another cue some people might find visually helpful is feel as if you're taking your fingertips and you're gliding them together, like your hip bones are coming together. And that can also help. So within the transverse abdominis, I can't get away without saying something about the pelvic floor as well. So think about this. You want your multifidus, which is in another trainer tip. We talk about how to activate that through a tailbone lift. The transverse abdominis, we also would like to have our pelvic floor firing, as well as a smooth and consistent and relaxed breath. Those four help really facilitate a strong core. So we're breaking it down right now, just talking about the transverse abdominis. But in your workouts, you want to make sure that you're addressing all four components so that you give that person the best absolute core they can possibly have.